What's up? It's Way Up with Angela Yee. I'm here. And of course, my girl, Coach Gessie, is here with me.
Yay! I'm so excited to be here with you today.
Yes, and you have a friend who's going to be a friend to the show permanently.
Yes,
Dr.
she
April
is.
Spencer is here with us.
Yes,
Hi, so happy to be
exciting.
here. Thanks for having me.
Exciting.
Love New York.
And yes, to have this conversation about breast health. Now, you are a breast surgeon, and we want to talk today about prevention, about early detection, and all about myth busting as well.
Yes.
Absolutely.
All right, so some of your background. So you're from Chicago.
Well, I'm originally from Atlanta, but
from
I was
Atlanta?
born in Chicago.
Okay.
Yes, but
No, I was
raised
going to
in
say,
Atlanta.
you were born in Chicago, but raised in Atlanta.
Yes.
Okay, so even just you being in Atlanta, you actually, for medicine, you went to Morehouse College?
I did. I went to Morehouse School of Medicine and MD Anderson Cancer Center for the surgical oncology piece.
Okay.
Yeah.
What made you decide that was your path?
You know, it's one of those things that chose me. When I was in training, it was at the height of the crack epidemic and the gang wars in the city of Atlanta, and it was lots of gunshots, car accidents, stabbings, you name it. That is what was going on. And so I was at a very busy trauma center, but it wasn't until I started to interface with Black women that were similar to my age. At the time, I was about 26, 27, that were getting breast cancer at an alarming rate. And because it was a community hospital, we got some of the most advanced cases, because a lot of these women were uninsured or underinsured or ignored, and they didn't have advocacy. And that's one of the things that Coach Gessie talked a lot about, just being your own advocate. So a lot of those women would see me after having gone to other private hospitals and being brushed off. So they would go to the urban center and we would get them taken care of.
And that's actually
by
why
someone that looks like them. So
most of Black women die from breast cancer more than any other ethnic group, because we are diagnosed at later stages because of what you're talking about.
And that's why all of these conversations about making sure that you get screened earlier and early detection is such an important conversation.
it is. Yeah, but one of the things that we're seeing right now, Angela, is there was this alarming study that recently came out by the American Cancer Society highlighting an increase in cancer in general, but particularly breast cancer in young women. And I've been doing breast surgery for over 20 years, and I have never seen anything like it. Like, I've diagnosed several women just last week in their 30s with advanced breast cancer, stage 3, stage 4s. And so we definitely need, we'll take a deep dive into that. And I certainly took a deep dive in my book about the rise in cancer among the youth, because these are our
beat it, and
sisters.
move on.
Yeah,
And-
one of the
and-
key
and our
things.
children.
Key things
Yes.
is that when you talk about early detection, right? So I wanted to actually reference the interview that just has been trending recently with Ananda and Sarah Seidner, who on CNN, they did a talk around their very two different journeys, breast cancer journeys. Ananda spoke about how she decided to really take control of it holistically and try to work the tumor out of her body through, she did do some chemo, she did immunotherapy, detoxing, things like that. And Sarah, she actually went and did a double mastectomy, right? And both of their journeys very diverse, but one of the things that came up is that mammograms, for instance, is something that there's studies, they're not studies, they're people who are saying that you shouldn't do mammograms.
The radiation.
Because they're saying the exposure to radiation. That's one of the myths I wanted us to bust here today, because that was one of the things that Ananda actually was concerned about. And it is critical to early detection, right? So do you want to talk about that a little
sure.
bit?
And again, I do talk about this in my book, Treat It, Beat It, Move On, because it's a whole section on myth busting.
Right.
And one of the things that I highlight is a lot of those studies, number one, it's old data. Even some of the current studies don't take into consideration the new technology. So we actually get more radiation flying from New York City to LA than we do getting a mammogram.
Right.
Wow.
And so people need to understand that we have more exposure, micro exposure, just walking around than you would in a mammogram.
Wow.
And the bottom line is the risks, and I'm from a clinical standpoint, there are risks to everything we do, including
Everything we
radiation.
do.
There's a risk to not getting one.
Exactly. But that's where I was going with this, Angela.
Yeah.
The benefit far outweighs the risk, because the bottom line is early detection still means better protection when it comes to getting screened.
What is the age now now that they're saying? And then I also know
that's an issue right there.
Right. What is the age now that you should be getting a mammogram? And also, people talk about family history, but it is possible to have breast cancer and not have a family history of it.
Yeah. And that is one of the challenges because the screening mammogram age is currently 40. Right. However, because we're seeing an increasing rate among the young, a lot of them are not even at screening age yet when they are diagnosed with breast cancer. The young lady that I saw, just a few days ago, she hadn't gotten screened. She just had a breast concern underneath her arm. And she just kind of overlooked it because it wasn't in her breast. And she hadn't got screened because of her age being under 40. So I always share with my younger patients that if you see something, say something. If you have a concern, let someone know. We are obligated. We are absolutely obligated to order imaging. And we call it diagnostic imaging because screening is imaging in the absence of disease, meaning you don't feel anything, you're not concerned about anything. So we're obligated to order the diagnostic imaging, and the insurance companies are obligated to cover it. We have to use a certain code, so you have to put in, lump, nipple discharge, whatever it is.
Something of concern that's present.
And in getting to the family history, most women that are diagnosed with breast cancer don't have a family history.
Isn't that crazy?
But it is. But it's important that we talk about family history so you can bring it up with your doctor and they can get prompted to
So that brings
you.
up to me something that we talk about here a lot. Again, with the Detox Now, we talk about the detox lifestyle. And the reason is because there are things that we have to do to advocate for ourselves to take control of our health, right? And you just spoke to the fact that women are getting diagnosed at earlier stages. They don't qualify for screening, but they have to know their bodies, right? So when we talked about the things that people look for, I'd love for you to share. It's not knowing your body is not just, do I have a lump? Right. But there are other indicators that I've heard you talk about.
Yes. And so some of the other indicators that we don't talk a lot about is the things that we see. And a lot of times we'll talk ourselves out of it. A rash, nipple discharge, nipple inversion because there's a lump behind the nipple as it's growing, it pulls the nipple inward, or even concerns underneath the arm, or if one breast starts to become larger than the other. And so that's why it's super important that we not just focus on the monthly breast exam. A lot of people were kind of up in arms that a lot of our oncology organizations
about, not the manual exam,
are getting away from having women do the breast self-exam. It's not that there isn't any value to it, but so many women were ignoring the other things that you mentioned.
So it's more inclusive.
It's more
inclusive. It's not don't do it.
Yes.
It's do more.
And men can also get breast cancer too.
Yes. I did a mastectomy on a man 2 Fridays ago.
Right.
And a lot of men I think it's underreported. It's about 1% is what the data show, but I think that's definitely unreported. So usually the men will come in like this. So I feel this lump in my breast has been here for a while, but I don't know. I've been working out, maybe it's from the gym, or I helped my daughter move and this box hit my chest and it went down. Now it went back up. So it's like they're like trying to undo, but also people, just because you stay away doesn't mean it's going to go away. So you got to come in. But we've got to work on our relationship. We have a big problem with customer service in medicine. And Coach Gessie talks a lot about that. And that's why she's a huge proponent of just being your own advocate and having someone with you and knowing that. I love when she says this. It's 2 experts in the room, your doctor and you as a patient.
So I recently I shared about how my cousin, died.
Jonathan.
Yeah, my cousin Jonathan. I was here last time. I asked you guys for support and prayers and thank you, because he was 35 and battling in the ICU with colon cancer. He was diagnosed at stage 3 at 35 years old.
So what symptom was he having? Any
So
symptoms?
that's what I was going to get into. So he had in January he went to the doctor for back pain, right? So he was misdiagnosed because he was treated as if he had like a slip disc in his back, sent to the doctor for physical therapy, et cetera. So, in my last moments with him, I recorded something and I shared it, I posted it, and I was, oh my God, I was devastated by some of the comments that were so evil. And
wow, really?
I mean, evil, like you killed him. And I was, whoa, yes, it was terrible. And the reason I even shared it, oh God, I get so emotional to think about it right now, is because when I go through something unimaginable, the first thing I think of, oh my God, how many people are going through this right now? What can I do to help them, right? And I shared my 3 lessons. I call them 3 laws for health equity, All right, and they are appropriate in every case. 3 laws for health equity. Number 1, it is the way I say is whether it's provider, the physician, or the patient. If you listen to your BAE, your body, your advocates, and your experts, you can have better health outcomes. And your BAE is your body, means that pain is a vital sign. Don't ignore pain. It's a vital sign that requires an urgent interaction, right? So think about that. In my cousin's case, he had pain. But one of the key things when you have pain, you need to ask for a differentials diagnosis. Now, you're very familiar with that term, because what happened is instead of asking, hey, what could my pain be? What is your differential diagnosis, doctor? The doctor then would have had to say, oh, what other ailments have these symptoms? And what evidence do you have to prove it's not the monster in the room? Now, what's worse is his dad died from pancreatic cancer 16 years prior. Yeah. So the very first thing the doctor should have done with the differentials diagnosis is have request imaging to ensure that it wasn't cancer. That was never done.
So here's the thing about differential diagnosis. It's something that we learn in medical school to make a list of the things that it's most likely to be to the least likely. So it's like maybe a scale of 1 to 10, and we have a list, and then we go down a path to figure out is it or is it not. And so that will involve imaging. It's not something that we necessarily share with patients, because it's kind of when you write a paper and you're brainstorming, you put your notes down. Right. But I think it's important that she mentioned so
because
that patients
it helps
can
you
be
accountable, but it helps the patient.
So you can request that.
You can just ask like, what is your differential diagnosis? Because we're not like robots and just like, write 5 things down in the medical chart, but we're thinking.
Right.
And, as surgeons and scientists, we have to come up with a list, but then we have to have a way in which to figure out if it is a particular diagnosis or if it is not.
So that time, imaging, in his case, in January, they would have at least requested imaging, right? Yeah. He didn't find out. He didn't get imaging until late May, okay? And at that point, it now had metastasized into his hip. Right. So going back to the BAE, it's your body, right? Do not ignore pain. Pain is a vital sign. Your A is your advocates. Medical bias is real. It is real, and everybody deserves and needs an advocate in the room, and you have to be your first advocate, right? And then, of course, I believe that everybody should have an advocate with them if they're in the hospital or at a physician's office. And the last one is the E, which is your experts. I believe anytime you go into a physician's office, there are 2 experts in the room. It's the physician, who is the expert in their field, and then there's you, who's the expert on yourself. So if someone is not going to respect, they're going to dismiss your expertise, you're never going to get the help that you need. You need to go to another physician. And I always encourage
patients to get a first, second, or third opinion if you have to.
That's because you're a secure, good physician.
Yeah. You're like, I know my
important.
business.
Don't feel like, you're insulting us. We welcome it. We welcome questions. But we just need to start healing the relationship. And that's why I think it's wonderful that you're having this discussion.
Absolutely.
Because the more people hear it, the more they see it. You kind of pull back the curtain on the medical mystique, because there's so much bias, both conscious and unconscious bias historically. And again, I talk about that in the book because we have to heal and we can't stay in the past. So you've got to have conversations about just healing the doctor-patient relationship. And I had a similar situation when I was in my mid-20s. I came across a patient who had been treated for an abscess. She was just 26 years old, had just had a baby, and so people assume it was lactational. But a lot of times with breast cancer, there's no pain.
Right.
And so you just have this wound, and she's being treated with antibiotics for almost a year.
Wow.
And again, she came to the community hospital.
A year.
Wow.
And I did her biopsy. It was positive. This was on a Wednesday. Friday, I get a call from the emergency room, and they said, your patient that you did the biopsy on is having complications from the biopsy. I'm like, well, what type of complications? They said she's having back pain. And I was like, that's metastatic disease, even though she was only 20, in her mid 20s, but, did the scans, and yes, that is what it was.
That means it had spread.
Yes.
The cancer had spread.
Yeah, because it was a year that she was untreated. Now, let me ask you this. There's also this myth about biopsies.
Thank you.
And how that can be harmful.
Yes.
So can we talk about that? Because some people feel like that's something that can cause cancer to spread. And
yes, it's such a big myth. Again, it was added to the book. It's a list of myths. And so from a physiological standpoint, tumors need a blood supply in order to thrive, in order to grow. They need nutrients, and you get that from blood supply, and you get that from lymphatics. So when you do a biopsy, we are actually disrupting that. It's just a vacuum, and we are taking the cells out. And so we are disrupting the source. And so when it comes out, it's not seeding, it's not growing, because it doesn't have a source of support, of nutritional support. And we call that angiogenesis. So in order for a tumor to grow, it needs a blood supply. And so a biopsy doesn't give it a blood supply. It's not going to cause it to spread or get larger. Now, what does happen, and we kind of have to talk about the past to move forward to the future. So in the past, there was no insurance. People pay for everything by cash, cows, land, etc., because that was the only way we had the ability to get ourselves taken care of. And because healthcare was self-pay, most people didn't go to the doctor until they felt pain, until they were having symptoms. So and there also wasn't a lot of and there wasn't a lot of imaging. We didn't have the fancy 3D mammograms and the CT scans and the MRIs. So when someone came in, we had to take them straight to surgery. So people start to associate surgery and procedures with the spread of cancer. So when we would go in, the procedure is called an exploratory laparotomy. And that just means we make an incision and we explore it and seeing what's going on inside.
It's for diagnosing
but oftentimes, yes, because we didn't have scans. And so people start to associate hospitals, biopsies, surgery with cancer spreading. And one of the things that patients find helpful is I tell them, you know, it's not airborne. Otherwise, everyone in your house will get the cancer that you have.
Right.
It can only survive with a blood supply. So our goal is to take the tumor and the blood supply and the lymphatics, everything around it. We call it margins. So we take the tumor plus some clear areas around it. So again, I just want to encourage people to get biopsies.
Do not believe that fake,
and
fake
these
news.
Conversations, anything like there's no such thing as a stupid question.
It's not.
So we want to just make sure we get it all out there right now. And I want to ask you, the book is called Treat It, Beat It, and Move On.
Yes.
So what made you title it that?
And the subtitle is from a praying surgeon's perspective and regarding prevention and just living your best life. What made me gave it that title is because so many times in our culture, we have been celebrating being a survivor.
Yeah.
And I submit to you, we are much better than being a survivor.
Yes,
we are
come on
thrivers.
Yes.
And so my goal was just to allow women to know that you can get your power back. And men to know they can get their power back. And so surviving means you're barely getting by, and we are existing in a shell of ourselves. And so it's like, listen, we lean on our advocates, we lean on prayer, we lean on spirituality. We bring in all the troops to complement. You don't have to choose. And so I wanted people to know that you're going to treat it, you're going to beat it, and you move on in the sense that, listen, you're going to live.
Right.
This is not going to be a death sentence. You know, as a man thinketh, so is he. So you have to think positive and believe it. No, you're not a survivor. You're a thriver, and we're going to move on to
even
some
stronger.
bigger and better things. and yes, I just wanted to encourage people that you are going to be leaner, stronger, spiritually stronger, live longer, and cancer free. And that's the goal.
Now, Coach Gessie, I know everybody knows about your holistic approach. That's what we always bond and connect on. But of course, both things are necessary.
Both.
Right?
Absolutely.
And so I want to talk to you about, we discussed Ananda Lewis briefly and what she had to say about her holistic approach when she found out she had breast cancer. And I want to ask you this too, Dr. April Spencer. If a patient did come to you and say that, then what do you do? Because I'm sure there are people who, in that same way, are like, I don't want to do this. I don't trust going to the doctor. I don't want radiation. I don't want to do those things. I just need to change my diet and figure out how to take it from there. What would you say to a patient like that?
They say it all the time.
All the
and
time.
what I share with them is, listen, what the study shows, I have evidence-based practice, so it's no pseudoscience talk. So I say, listen, what the data show is women that just check the medical boxes and do your surgery, your chemo and radiation, have certain outcomes. Women that only do their herbs and supplements and go at it alone have another outcome. But what we know is when you complement them together, you have the absolute best outcome. Absolutely. So I share with my women, you don't have to stop what you're doing. In fact, if what you're doing is making you feel better and you're feeling strong, you can continue that. But we also are going to have to go to surgery and get this tumor out. We're also going to need chemotherapy possibly, and you may need radiation. But I want you to continue on your wellness path because you have to do what makes sense for you. Because everything we do, there's inherent risk involved. But I think people feel empowered the patients feel like I'm not making them feel bad for
Absolutely.
doing it.
Right.
I don't even call it alternative medicine. I call it complementary. The complementary approach. And I would always
Love
do this.
that.
We're going to do it together.
Yeah.
And that gives you the best possible outcomes.
I've had a recent breast cancer scare. And first of all, I wanted to say, Ananda, I spoke to her the day her story came out.
Okay.
And since her stage was upgraded to 4, she actually became more aggressive in her treatment. And she is doing much better. So
that's great.
She said, unfortunately, many people didn't share that part of the story.
Right. Well, that's good. We're happy to hear
so
that.
we love you, Ananda, which is really important. What were you going to say?
I was going to say, I'm glad you shared that. And I briefly discussed that on CNN on Sunday. And we didn't get a chance to take a really deep dive, but they played the clip first. And I watched the video. And I felt that it was important that I did not leave that station without mentioning that what she did was not bad. It was just her approach, but we still have to do it in a complementary fashion. We've got to start educating our clinicians and our healthcare providers, and as patients, being an advocate for yourself and say, hey, I'm taking these things. And if they're not on board, you may have to get a second or third opinion, but you've got to be open to not antagonizing patients for wanting to do complementary medicine, but just encouraging them that, hey, we can do them both. But a lot of physicians themselves aren't comfortable. They say, hey,
and they're demeaning.
If you're doing that,
and they're demeaning.
I'm not going to do your surgery.
Oh, why are you going to waste that?
Wow, that's wild.
What?
That's
so
very
a lot of
wild.
patients that see me, I'm their second or third opinion because a lot of physicians refuse to treat them.
Didn't I say I bring unicorns up in here?
But,
Come on now.
But I have to say, we got to make a deal. I tell them all the time, it's not Burger King. You can't have it your way. We're going to do it complimentary. So I'm all about inclusion, not exclusion.
Absolutely.
Yeah.
Now, we also know stories of people who are like, okay, I don't want to share my diagnosis with people. I don't want people feeling sorry for me. I also don't want people to be worried about me. And so how can people be supportive when somebody comes to them to let them know, look, I've been diagnosed with breast cancer? You know, what are some things that you can tell people who love someone and are around them and want to help?
Yeah. So being a caretaker can be just as challenging because you have someone around you feel absolutely hopeless. So the main thing is people thrive when they don't feel like they're the sick person in the room, like something's wrong. In fact, a lot of people feel great until you tell them they have a cancer diagnosis, and then they feel like everything's happening.
Falling apart.
Yes, everything's falling apart. So just don't make them feel like the sick person in the room. They can still go out. You can still be encouraging. Most importantly, you can join them on their visits so that you can help be their eyes and ears. You can write things down, journal. My book has a journal component to it. So I have a list of top questions to ask if you've been diagnosed with breast cancer. Journal how you feeling, a whole section just for the caregiver and giving them insight as to things that they can do to be supportive of their loved one that's going through breast cancer. So we've got to talk about this.
Right.
If not, nothing's gonna change.
Yeah, and actually I want to talk about that scare I had recently. So back in March, so every year, first of all, Black women have denser breasts, and they actually tend to be diagnosed harder to diagnose because mammograms, the density of the breast affects them, right? So they ended up having to have more testing. So I'm one of those women, right? And I have to do my annual every January in March, and ultimately, I always have to have a follow-up, some sort of bilateral ultrasound, because they always want to take a further look because of that, right? So this year, instead of the ultrasound request, they said, oh, we see something new. We need to do a biopsy, a core biopsy. And I was like, okay, I know, I'm not going to, because a lot of times people just, they run from it. They don't want to schedule it. They're afraid. So I was like, okay, listen, cancer can't live in this body. Everything I'm doing, and whatever it is, I'm gonna fight it. So I'm gonna, attack it head on. Did the testing, and thank God, praise God, everything was clean. Hey, it was a fibroadenoma, which is a non-cancerous benign lump. Okay, basically, right? And which I have many of them already, but it was a new one. And then I had to follow up with another ultrasound 3 months later, which was just this past month, actually a couple of weeks ago. And again, it was clean, which was phenomenal, right? So, but the key thing for me was how many women have not made their appointments, right? Because so I said, you know what, I'm going to share my personal 3 tips for lowering my risk for breast cancer. Number one is do not run from the appointment. The worst thing, when people tell you it's better not to know, that's not opposite.
True, right?
It is the worst thing you could do is not know, right? It is much worse not to know.
Because if you stay away, it doesn't mean it's going to go away.
It's getting worse.
Yes.
Right. The sooner you address it, the more of a chance you have of beating it, right? And then moving on. So that's number one. Number two is please reduce your stressors, right? So chronic disease is the number one cause of chronic disease is chronic stress. So boosting your brain health, which helps your body manage stress better, as well as reducing and eliminating your stressors. That's another key thing. So zero tolerance for stress.
Cut some
toxic
people
people.
That's right.
That's the first thing we said. Cut some people off. Okay, toxic relationships. It's funny. I always say detox living is life free of toxic people, thoughts, people, habits, and foods. Foods is the least on the list. When we say toxicity, people think food, but the first thing are the people, right?
Yeah.
And then the last thing is a prevention lifestyle, an anti-inflammatory lifestyle. Guess what? Hormonal imbalance is one of the leading drivers of breast cancer, right? As well as vitamin D deficiency. Actually, I would say vitamin D sufficiency helps your body fight tumor inflammation, right? And chronic inflammation is one of those drivers as well. So for me, I take our prevention kit, these 3 supplements every day. Why? Because that is how I help my body fight and to lower my risk against breast cancer. And another thing I think is really important is that, open enrollment is around the corner. There are 2 things. One, vote. Because reproductive health,
like 2 weeks.
Reproductive
guys.
health is on the ballot.
Right. Yeah.
Access to care is on the ballot. So vote. Number one. Number 2 is please. I got my Health First sent me my letter. It's open enrollment time. It's time to renew your health care. Make sure that you can. I had no problem getting the doctors I want, getting the testing at the centers I want. I am a healthy Health First member, but whatever your insurance carrier, and I'm saying that, I'm shouting them out because they're from New York. So shout out Health First. But whoever your carrier is, make sure that they will cover your tests, right? They will cover the doctors that you want because the worst thing to do is you need care and you don't have coverage.
Well, here's the thing. I think people, the listeners, especially your young listeners, need to be aware of. A lot of those young patients are uninsured or underinsured. There is no open enrollment for them. And so they need to know that because a lot of their jobs, the unemployed or underemployed doesn't offer insurance, but they need to understand that if you do have insurance, they need to do exactly what she said to make sure they cover the doctors that's in their network, and they'll cover certain tests. But every major breast center has what we call a nurse navigator, and that is the person that will literally help you navigate the weeds of even the financial piece.
Okay.
So if you have a lump in your breast, if you have nipple discharge, you have breast concerns, you can get emergency breast Medicaid, and that is a national program.
Say that again.
And yes, emergency breast Medicaid. So you don't have to feel like, I had a
can't
patient.
afford this. Yeah.
The first thing she said when I mentioned to her that she was diagnosed with breast cancer, and she started crying, and she said, "I'm just trying to figure out how I'm going to afford this." And so finances are very much on people's minds. So I'm glad you mentioned that. But just know that there are a lot of programs. That's why, in the month of October, we're running the races and we're doing all these things to raise money. Money goes somewhere. So every hospital has a department to help women through their nurse navigator. There are grants for it. So you just
utilize that, find it, get the information.
So if you have something going on, for those who are listening, if you have a lump in your breast, you have breast concerns, make sure you schedule your mammogram. Before you go back to get your mammogram done, you're checking in, say, hey, I really need to speak to the nurse navigator about this being a self-pay. A lot of people don't know that the self-pay charge is not the same as what we would charge insurance. Usually it's just a fraction of the cost, like $100 versus, let's say, $500.
Right.
But if you don't know that, you can't necessarily be your advocate, and you can't depend on the person that's checking in, that's looking at the clock.
Right.
They're not necessarily going to volunteer their information. So I really want to empower your listeners, and I know you have listeners from all over the United States, to know that there are resources, and you can get them at the hospital. So this is kind of what we can do in terms of the the youth, and this is a big problem. We had 1.4% increase in the last 10 years, year over year, with the younger women in their 20s, 30s, and 40s, and those are those that are uninsured or underinsured, but there are resources out there. So
and
tap
there are
into
things
them.
that they can also do which they're not going to like. All right, I'm going to share them now. Number one is 2 ways of lowering your risk is no smoking. Right, smoking is, and as well as drinking alcohol. Alcohol, there are two things that disrupt your right.
A huge risk factor, and I call them the ABCs. And I've done this talk literally all over the world. It's simple enough, but I like to add clarity to complex issues. So the ABCs are breast cancer prevention. We've mentioned a lot of them already. So she's definitely a sister in the fight. She's on board, and I support what she's doing. But the A is just being aware of your anatomy. A lot of young people, they're so busy that they're not feeling what's going on or seeing things. So just be aware of your anatomy, be aware that there are resources, be aware of the guidelines 40, but if you see something, you say something, there are resources so that you can get that scheduled. And try to be aware of your family history. Now, the B is your behavior, which is what she mentioned, that you can be empowered. Like, you can't change the fact that you're female and getting older and have a family history, because those are like the most profound risk factors that we see with breast cancer. But your behavior is just making sure that you are more active. What's very unique to many people, especially the young, is that they have a sedentary lifestyle.
Right.
A lot of those young people are working
some lifestyle
from home.
changes.
A lot of people are working from home. And so you just encourage people to get up. The gym is wherever you are. You don't have to be in a gym as long as you are walking, moving.
Right.
This could be anything from
walking up the stairs instead of taking the escalator.
So taking the stairs instead of the elevator. Sex counts because that's activity.
Hey, I think I love that.
I worked out
twice a day.
Yes, parking inconveniently. Taking the train, mobile, like making sure you're out. The other piece is in terms of making sure you stop smoking and minimize your alcohol intake. My approach has always been focusing on inclusion and not exclusion, because exclusion for a lot of people is not sustainable.
Right.
You have people that's been smoking for 50 years. You think that patient is going to stop smoking? I have patients with lung cancer and they still smoke their cigarette.
I've seen that.
So you got to set realistic goals for people. And so in terms of inclusion, the C is your consumer choices. Choose things that are healthy, that are very directed, like your anti-inflammatories, which she's a huge proponent of, your vitamin D, which she has, which is data proven that women that have vitamin D deficiency, especially African-American Hispanic women, have a higher rate of breast cancer and breast cancer recurrence. And so be mindful of your consumer choices. The other thing is your culinary choices. Now, this is a question I get a lot. So when I diagnose a woman with breast cancer, one of the first things they say is, a lot of them will say, well, I'm vegan, I'm vegetarian, I have a raw diet. I've seen every type of diet. And I have a whole section of the book just on culinary choices. So it's not about exclusion, because I have patients that eat very healthy and they get cancer just like someone that is a carnivore, like myself.
Yeah. Because it could be something else that's driving it for them.
It's all about inclusion. So again, I have data-based practice, and so what the data show is that there are certain diets that you add has added value. And so one of those is a Mediterranean lifestyle, just adding more fresh fish, adding more things that are your omega-3s, your omega-6, your unsaturated fats. That is data proven to increase your longevity. So we're not suggesting that you'll never get cancer, you'll never get disease, but while you're here, you can live longer, you can live stronger. And so when you are affected by disease, your body can handle it a whole lot better.
Ooh, this has been an amazing conversation. I want to say the other day I spoke to Amy Robach, and she found out that she had breast cancer and had a double mastectomy, but only because she was doing a news segment. And part of it was, getting tested, and she went and got tested just on the news, not thinking anything. She had no symptoms, no signs, and found out, and then had a double mastectomy. And so that encouraged me to be like, okay, Angela, it's time to make your appointment to go get your mammogram, because I a lot of times will put things off because I'm so busy. I'm running here, I'm doing this, I'm doing that, but you can't neglect yourself.
No, ma'am.
And that's why I love your platform, Angela, because we have media partners to help spread the message. We can see so many more impact in terms of lives saved when they see someone like you that they trust and know. And that's one of the reasons I'm really proud to be one of the co-hosts of Urban MD TV.
Oh, yes. Fox Soul.
Yeah, so with Fox Soul, and our producer and creative is John Mark Sandiford. And one of the things that he emphasizes on the show is make sure he has clinicians that look like us.
Yes.
That we are pulling the curtain back on healthcare so that it's not as scary. If it
I would love for you to be my doctor. If that was my doctor, I'd be like, girl, what time should I come in?
I appreciate that. But I always tell people, in all fairness, I said, we are very blessed. I don't have to see all the patients. I just want to inspire you to see someone. And Urban MD TV gives us a platform to do that, where they may not be, where we are, but if we can get the messaging out, we have people like you, people like, the Urban MD TV show, and this big voice here that is amazing, just making sure she's getting the word out, because you guys help us save lives. It's only so much I can do in the operating room and in the four walls of my office. Yeah. But if they're listening to Way Up, it's going to resonate way better than them hearing it or seeing it with a doctor they don't connect to.
Right.
Or if they see her on her Instagram, she's so vocal and so passionate. She gets in real close and she leans in, and they're like, okay, she's leaning in, the blue eyeshadow. Listen, she's about to let me know. But people trust the faces. And then again, Urban MD TV, people, it's not a show out there that's like it.
Nothing like it. That's great.
Like it. Yeah.
And I hope this also encourages. I hope this also does encourage more people to want to become doctors
and be the difference makers.
And our producer insists that we wear our white coat for many of the segments, because we want to dispel that myth that white coat is someone that can't be trusted. He wants to promote the fact that, #excellence is our hobby, and we look just like you, and we are for you, and we're going to advocate for you. I love it. I even got a colonoscopy on air on our episodes. But again, it was for the people, because people are afraid
what
to
we
do
do
it.
for you, y'all. What we do for you.
How uncomfortable was that?
I think about her family member Jonathan.
Yeah.
And so we've got to let people know that we are here to help. We are your advocates. We're your allies, and
you're
a big
not
part
alone.
of your advocates.
That's why I do this, because you're not alone.
And this is what's going to happen when you get it done. It's not as scary as you think.
And I think the more information you know, the more comfortable you'll be. And being able to know it and have the right questions to ask, those things all matter a lot. So I appreciate you for taking time today.
So
and look, your lip color has had me in a trance this whole time. And I do want to say that in addition to all of that, you do have this tailor-made.
Non-toxic, tailor-made.
Of course, it's non-toxic.
Of course. Yes.
Safe, sexy, and simple.
You still got to be cute when you go to the doctor.
That's right.
And Ange, as we approach this gift giving season, I always got something for our Way Up people.
Yes.
So what we want to do with the Detox Now is actually we're giving you guys a $25 gift card at the Detox Now to share your thoughts on how we can make things better for you. So just take our 2-minute survey. How we can make things better for you, because at the end, we want to make it easier for you to know better, do better, and live better. So just go to thedetoxnow.com, get your $25 gift card, and shop.
Like that. And you also have your Just Breast vitamins that you came up with as well, that you created. It's a supplement. So just give us some information on that, too.
Oh, yeah. So I'm very proud of it. It's backed by science. And the Just Breast vitamin is just one pill. I didn't want being healthy to be a hassle. So it reduces the inflammation in the body, reduces your overall body fat, because fat can mimic estrogen, which can drive tumors. It has a beauty component, so it supports your hair, nails, and skin, and robust immune boosting.
Okay.
So, and it's all phytonutrients, mushroom based, plant based. So, and the key thing, which makes it different from the vitamins that are out there now, is that I purposefully exclude anything that may interact with any of your medication, particularly for women that are currently battling or have breast cancer.
Okay.
So no vitamins A, C, and E, because that can make your treatment regimen less effective. So all the things you need and the things you don't need.
What is that? Can you share a little bit more about the A, C, and E, why that interacts?
Yeah, because a lot of the medication helps reduce the oxidative stress, and that's how we're killing the tumor. We're cutting off the blood supply and oxidizing it. But when you take antioxidants, it counteracts the
It's
therapy.
really important when you're in treatment.
Yeah, yeah. And so it's good to, just collaborate and be aware of supplements that have you in mind, and that's why it's just breasts. And so it's just for women to get it done.
All right. Well, Dr. Aaron Spencer and Coach Gessie, two people who I trust.
Yeah.
I appreciate you guys, though, for taking the time today. This was such a great and important conversation.
Thank you. Thank you for having me. It is a privilege to have the podium. Absolute privilege.
And you'll be back, so.
That's right. I told her this is the first of many conversations.
All right.
I love that.
Way up.
Way up.